People are always understandably worried that the cancer is going to come back. And after you get a number of years out and that risk decreases, it's often a surprise when some of these long-term effects pop up as problems. And I think it's scary because if you're having trouble with your memory, if you're having trouble concentrating, the natural place to go is maybe the cancer has returned. And so that can be really terrifying. And it's important to know ahead of time that these things can happen so that you can, number one, expect it and be prepared for it. Number two, seek early intervention so that we can make sure that the patient is continuing to succeed and to, do all that we can to minimize those long-term effects. Addressing the long-term effects of therapy is often best done by people who deal with that every day, by experts in neuro-oncology or in long-term effects of childhood cancer therapy. And if that's not a provider that you have had 20 years of care with, it's really important to come to them with the comprehensive medical record so that they know exactly what medicines your child received, exactly what therapy was applied a number of years ago. And it's often difficult 10, 20, 30 years later when there may be a long-term effect of therapy that needs to be addressed medically to get those records from the hospital at which the therapy was delivered. So it's an excellent practice to keep a copy of the comprehensive medical record. You never know when you're going to need it. In addition to addressing the potential cognitive effects or brain function effects of brain tumor therapy, there are a number of potential medical complications that need to be monitored for, and that's best done in a center that has good experience in such monitoring. The neuro-oncologist who provided the therapy is a great place to continue to get care. Centers that have dedicated clinics focused on long-term effects of childhood cancer therapy and childhood brain tumor therapy are excellent if you have access to them.